I'm Dr. Rashid Lui, Department of Medicine and Therapeutics. It's been an interesting journey. It's been very busy, but I think it's very fulfilling. And at the end of the day, it's trying to acquire life skills and knowledge to help patients. I started off as a physician, so an internal medicine doctor. And then after my training, I decided to get into gastroenterology and hepatology as my subspecialty. And then I just noted that how it's currently set up in Hong Kong and also in many places in the world, it's actually not a very patient-centric setup. So the patient actually has to float around quite often, even within the same hospital, to different specialties. One of the first thoughts that came to mind is there any way we can do better or help them more? So after I finished my gastro training, I had some very good mentors, and they were very supportive of me just going further and training in oncology as well. Hopefully to know more about the whole treatment pathway to better help our patients. If we bunch all of the digestive cancers together, we're talking about it's probably one of the top cancers in Hong Kong. So the new case incidence is almost 30% of all new cases in Hong Kong. In this field, I actually gravitate towards helping those patients with early onset cancers. And one of the reasons is because like during my clinical practice, I encountered a very young lady with very unfortunately having very late-stage colorectal cancers. So we tried to use a lot of like chemotherapies, targeted agents to help her. But at the end of the day, she progressed and wasn't really responsive. That had me thinking, could we do better for these? Like, is it genetic? Is it environmental? And it's really a research question that a lot of people are looking into. It might be the microbiota. And so my efforts are mainly along the lines of helping these early onset digestive cancers. We started to provide these FMTs, which is fecal microbiota transplantation in short. Currently, it's available in the Prince of Wales Hospital already, and we're helping them train other gastroenterologists and endoscopists to perform this procedure. And later on, we'll be expanding to other clusters and hospitals in Hong Kong. And the main indication would be for some really difficult to treat Clostridioides difficile infections. We know these patients don't respond well to repeated antibiotics, so having FMT is actually a life-saving treatment option for a lot of these patients. I actually went on this journey of like first doing my medicine training, then gastroenterology, then medical oncology, and then genetics and genomics is because patients are devastated when you tell them they have cancer, right? These patients are then subjected to this really complex healthcare system. So they're jumping around various subspecialties, and it's actually not a very patient-centric setup. So I think one of the goals that I'm really trying to do is that if we're able to integrate everything into a one-stop comprehensive cancer service where we can care for the patient from diagnosis, risk screening, family counseling, and even to the palliative stages of giving chemotherapy, etc. So you can see that we're trying to make it a more straightforward patient flow for the patient. At the beginning, the patient already establishes a good rapport with us, and along the way, it's kind of like a case manager. It's going to take some time, but I think we can try to make really small incremental changes to see if we can build on this thought and make it more structured. I'm very happy to have received the award, but I think the award is also recognition of the team effort that was placed and a lot of hard work of other people together, or else it would be difficult to achieve such success. And firstly, I think I have to thank the whole GI team in the Prince of Wales Hospital, the faculty, because they've been very supportive. I think it's, more importantly, it's a very good platform and opportunity to highlight the work we're doing here at the Prince of Wales Hospital and together with the faculty, and hopefully to let more people general know the good work we're doing here, where we're really at the forefront of science, where we're really providing life-saving treatments for the public healthcare sector, and really recognize the efforts of the entire team here.